horrible. Please treat me like that. So I gave the treatment. Afterwards, after the 3 days, next photo is after the 3 days. And afterwards he came to me and told, sir, I want to bike the ride, but these my family members have told me don't ride bike like that. So, and also in our village people, they decided that this is my destiny. Because of you I am alive, like that. That is Ayurveda. That is who told that Ayurveda is slow. And also, then after 3 days, it is completely gone off. That marks only we can observe. Next slide. This is an herpes orbitalis, that is Vasaja Visarpa. In the Vasaja Visarpa, they told that Davatuhu. In the Chakrapani, he explained, Davatuhu means burning sensation in the eye and the mouth, etc. Further, only we can observe herpes orbitalis, herpes orbitalis, herpes genitalis, and herpes labialis as a visarpa. Unfortunately, I'd add that this is an herpes orbitalis with the herpes simplex virus, that is Vasaja Visarpa. And everything I explained, if you are neglected, his son's eyes becomes bulge. And next day, his eyes are gone. Like that I explained. But he took the treatment and he got to his home, and his grandfather is scolding everything. Don't give these medicines, because if anything it is happen, adverse effect will happen, we can lose his eyes like that. So he neglected, those parents are neglected. Before the next day only, he got complete closed his eyes. Means his eyes become swollen and eyes is closed. So unfortunately I can't do, I'm not there in my place, in my native, I'm out of station. He called me and told everything. So I suggested, I'm out of station, please go with the allopathic doctor, because no one Ayurvedic doctors in my place. So go to the physician and explain everything. So he scolded him and everything. He misguided him. This is not a herpes simplex virus like that. Unfortunately, he is not at all treated. He is not also treated. He referred to somebody in this district place. So, means if we having the full knowledge about the disease, no one can beat. The old age is come to retirement like that. He's foolish fellow. He says like that, and he sent to them to other hospital like that. Next please. This is herpes genitalia, means the herpes infection to the penis and in the back and everything. This is also herpes simplex virus, that is Vasaja Visarpa. The next case. This is also very interesting case. The patient name is Harish, age of 16 years. She at the time of writing an exam, means it's a 10th exam. In Karnataka it is public exam. It's very important. I don't know any Gujarat. It is also written. Okay. In the public exam, he is very intelligent. Before that, in one school is there in like that. In that school, everyone small children get mumps and chickenpox oftenly. So I gave one guest lecturing before for the 10 students. I explained everything, but they neglected. While writing the exam, when the exam it is completed, at afternoon he got rashes all over the body. And then he called me. At that time also I am having consultation in district place, that is Jagalur. So I may explain. Before that you treated to her sister. So you should take all those medicines. And unfortunately he got to that doctor. He told that extra for the applying your ointment, he got an contact dermatitis. Okay, that is allergic like that he told. Okay, everything it is okay because his faith in with me. So he came again at morning. These are the symptoms we can observe. And after that, I gave nimba kashaya for the snana, and for the bath I advise nimba kashaya, means nimba kalka ये गर्म पानी में मिक्स करके स्नान करो. And हवा करने का यूज करता है ना, हाथ से चलाओ बहु. ओके, ये प्रिपेयर करने का नीम के प्रिपेयर करो और लगाओ ऐसा, और नीम और टर्मरिक के साथ एक्सटर्नल एप्लीकेशन करो, एंड देन कासा दिखो एप्लीकेशन करो. I gave mentally strong and counseling everything. In the bed also you should read because your main exam like that. And I wrote a letter to the examiner. Please give separation because if we get other students, their life also it will spoil. So give separate room, hall, and here fan, under the fan which are the window light, and near the window like that. I wrote in one letter. They did everything. And next photo. Next slide. And after the completion of the exam, he came to me like this, and he got luckily distinction mark. Next slide. I explained that you should observe the crack. That is Vataja Visapa, as I explained, no cracks. Everyone since 3 days, since 6 months, she got cracks in the lips, and then cracks in the lips, and afterwards, everyone they gave the Biolin, Vaseline like that. And I gone to the history. She told starting it will come as a blister, small blisters with water and discharge. Then afterwards it become cracks. So I gave antiviral treatment. It's completely gone off. This is diagnosed as herpes simplex and herpes labialis. That is what it will come. And I explained another one story. Related to Kadam Visarpa. He is having diabetes mellitus since 6 months. Means uncontrolled diabetes mellitus. Uncontrolled diabetes mellitus में क्या हो रहा है? Up to 600 insulin लेना तो एक tablet glycemic तो 2 tablets BID लेने तो sugar level कम नहीं हो रहा है. And afterwards I gave, before that only, I simply gone for Indukanta Kashayam like Indukanti Krusam like that. Very next day he come to me, I'm having blisters on the mouth. Means I'm having mouth ulcers like that. Suddenly I changed it, and diagnosis I changed it. That is due to herpes virus. That is cytomegalovirus. So I treated with Pachati Kokulu with the Snehapana. After the Snehapana only, sugar level came to 300. I think exactly 320. And after the completion of Pamana, his sugar level is 250. And I gave again Videshana treatment. Then now only his sugar level is 120, 80 to 120. That is normal range. So diagnosis is very, very important. For that only you should read modern books, not medicine, not science and symptoms, and clinical cultures, everything. Okay. Then I am going to then discussion. Viral disorders are fast-spreading, dangerous, and life-threatening disorders. So everyone must try to prevent the spread of virus and prevent the further complication by utilizing our Indian system of medicine. Next slide. I will go to fungal infections. Any doubts? If you having any doubts, please.